for introducing the elite career into my life. I'm Cindy. It's my privilege to become MC for tonight's webinar topic for the silent killer cancer. I would like to thank all of you for taking your time to join us this evening. So actually, before we begin, our AV team already mute the Zoom app to prevent any interruption to the meeting. So later on, we will have a Q&A session. If you have any questions, you can unmute to voice your questions. But if you do not wish to on your mic, you may use the chat functions to type in your questions. There will be a pictures displayed during the presentation. If you can't see it clearly, you may zoom in for a clearer view. Yeah, I see some of our new friends here. Good evening, Dennis. Good evening, Shireen. Good evening, Jennifer. I'm so glad that you all join us for today this evening webinar. Nowadays, cancer rates are increasing over time. Unlike other terrifying diseases, cancer usually really quite common. It's the second leading cause of death in the world after heart disease. And in 2018, there were an estimated 9.6 million deaths worldwide due to cancer. There are about 20 million new cancer cases and nearly 10 million cancer deaths in 2022. Cancer occurs in people of all ages and can affect any part of the body. And cancer is the leading cause of death for children as well. Every year, there are about 300,000 new cases diagnosed in children who are below the age of 18. About 38% of people will be diagnosed with cancer in their lifetime. I believe nowadays, medical science is very advanced, but why do some people get cancer and others don't? What exactly is cancer? And can cancer be easily prevented? And what is the difference between medical and preventive science? So I'm actually quite sure we want to find out more. That's why we are here today and tonight. It's a privilege for us to invite a speaker to share with us the silent killer cancer. So let's welcome Cindy Gu to share with us.
Good evening, ladies and gentlemen. Firstly, I would like to thank EVG and my upline. My name is Cindy Khoo, and a very big welcome to all of you for attending tonight's webinar. The topic for this webinar is cancer, the silent killer. With a heavy heart, let's get to understand what exactly is cancer. I have seen a lot of people panic and at a loss of what to do when faced with cancer. Besides having to burden with costly medical expenses, the patients suffer the most, having to undergo the kind of pain during treatment and the constant worrying of any chances of recovery after treatment. Even family members will be equally as worried. They might have to face the reality that the family member might not make it through. The entire process is truly tormenting. A lot of cancer patients pass away shortly after they are diagnosed with cancer. This gives people the impression they are sentenced to death the moment they get cancer. But is this really the case? So, can cancer be prevented? Cancer is indeed scary, but if we don't understand about cancer, then it is even scarier. Tonight, let us get to really understand about cancer and prevent it from ever happening. Cancer is like a silent killer. There is no warning at all when it's devouring our health. According to World Health Organization, cancer is world number 2 killer. Cancer causes 1 in 8 deaths globally. Cancer takes away 10 million people yearly. Speaking of this, we tend to worry for someone when they get COVID. But can you imagine 10 million people die from cancer yearly? That is 1 cancer death every 3 seconds. And predicted by year 2032, the number of cancer deaths will increase to 13 million annually. In fact, cancer cells are mutated from normal cell. The red one on the left are normal cell. Normally, the cells divide and multiply in an orderly manner, and cells can live up to 90 to 180 days. Children and infants have the fastest growth. However, some organs stop reproducing when they reach a certain stage. For example, women during menopause will not be possible to get pregnant, right? But the main difference is normal cells will go into apoptosis, meaning die off, if it is injured and cannot be repaired. Picture on the right shows when cell apoptosis malfunction, normal cell will mutate into cancer cells. They will continue to grow and divide forever. We call these cells immortality cell. So what exactly is cancer? Cancer is a condition in which these mutated cells are uncontrollable and will multiply and grow in large number, and then destroy our normal bodily functions. In other words, they will invade and even occupy our organs until the organ malfunction. The person will die when cancer cells destroy the immune system. So, can cancer be easily prevented? In fact, Dr. Chow Fei Chen mentioned before, cancer does not happen overnight. We have to commit the same mistake 100 times for a cancer cell to form. In fact, cancer cell does not grow and divide as fast as we would have imagined. From one cancer cell split into two cells become four cells become 8 cells. It takes a few months for it to double. Some cancers even takes 6 to 8 months for it to double. Cancer does not happen overnight. When the amount of cancer cells reaches 1 millimeter, which is 1 mm, it's like making a period mark with a pencil. There is about 1 million cancer cells on that period mark, and only the most sophisticated medical equipment is able to detect it. If cancer tumor grow to 1 centimeter, which is a 1 cm tumor, it's like the size of an eraser at the end of a pencil. That already have about 1 billion cancer cells. And our body may not detect any tumor smaller than 1 cm. So usually those tumors that have been diagnosed are at least 2 to 3 cm size. And do you know some cancers are already in the terminal stage? When a malignant tumor grows to 10 cm, that person will be on the verge of death. Why is that so? Because there are only 60 to 80 trillion cells in our body. When the number of cancer cells is enough to destroy an organ, it will cut off the blood supply to other organs, and at the same time weaken the blood's ability to clot, which in turn causes some cancer patients dying of hemorrhage. And the toxic side effect from some cancer treatment can also suppress the functions of our immune system. In fact, 2/3 of the time, cancer stays hidden. It cannot be detected. We won't know it when a cancer cell is produced in our body. This is a so-called incubation period. Let's take a look at the duration it takes for different cancers to grow to 1 cm. For example, breast cancer takes 6 to 8 years. Colorectal cancer takes 10 to 20 years. Lung cancer takes 10 to 20 years. For example, if a woman is diagnosed with breast cancer at the age of 40 years old, it means that she has gotten cancer at the age of 32 or 34 years old. For example, if a person is diagnosed with breast cancer and this person always had regular checkup, but why it wasn't detected in the first place? In fact, this is what we call the incubation period, and it is not detectable by general devices. In fact, 2/3 of cancer period we are unaware of, so preventing cancer is always the wisest choice. What are the differences between benign and malignant tumor? Benign tumor is non-cancerous. They multiply at a slower rate. Tumors that only grow in the same place usually do not spread to other parts, such as cysts, warts, mole, polyps, etc. are all benign tumors. Generally speaking, this tumor can be removed by surgery without posing any health threat. If the tumor cells are completely removed, they will usually not reoccur, and the arrangement of these benign cells are relatively neat. But if it is a malignant tumor, it is cancerous. They grow rapidly and have obvious features. When under the microscope, the cells of malignant tumor are usually irregular and do not have a uniform structure. In this sense, it just represents a choice brought to the body by a malignant tumor. Even if surgical remove, malignant tumor can still spread or to other parts of the body, causing cancer to reoccur. Before being discovered, a tumor may contain millions of genetically identical and destructive cells. I'm sure now you are able to differentiate better. We often heard when some people are diagnosed with cancer, they will start to doubt, why is it me? What did I do to deserve this? They often feel they are living healthily and pose no risk for cancer. In fact, cancer occurs silently, which makes it difficult for people to understand, which also increases the difficulty of diagnosis and treatment. Sometimes it seems that everything seems fine on the surface, but cancer may still be lurking somewhere in the body. So the only way to fight cancer is early detection. In fact, our body is very smart, but our internal organ cannot communicate directly with us. They can only alert us via some symptom or pain that we can see or feel on the surface. This is also the precursor of cancer. Let's look at the first signs of and symptom of cancer, which is the appearance of lumps or thickening in some parts of the body. For example, when women go to O&G clinic, the doctor will teach them to touch and feel the limb around their breast. You can see in the picture, when a breast lump or thickening that feels different from the surround tissue and enlarged lymph node under the arm, doctor will recommend her to do further examination because most breast cancer have lump or thickening signs and symptoms. Some people will have discharge from nipple. It's not the kind of milk that produced during pregnancy. Retraction of the nipple, change in skin of the breast, such as dimpling or occurring redness and swelling. Breast cancer takes place most commonly among women. So women have to constantly check their breast and lymph nodes under their armpit for any abnormalities. But of course, breast cancer not only occurs in women, but men as well. It's just that chances in men are lower. But if men get breast cancer, their condition will be way more serious. Another lump or thickening related is testicular cancer, which is the male reproductive organ. If he has abnormal lump in his testicle, he may develop testicular cancer. Next up, let's take a look at skin cancer. What kind of skin changes are related to skin cancer? Let's look at the sign and symptom of skin cancer. A change in a wart or mole signs, such as size, shape, color, and texture. Unexplained bleeding, dry, scaly patches or pimples that never seem to go away. Constant itchy skin and rashes. Usually only warts or mole are seen on the body at the beginning. Have you encountered some people having a lot of warts? Their appearance is somewhat similar to corns, but corns are not a sign of cancer. But warts may develop into cancer because it is caused by virus. Some people may develop one or two at first, but we have to observe whether its shape, color, and structure have changed. It will have some changes if it is cancerous, such as it's getting bigger, spreading more and more, changes in the shape, changes from light brown to dark color. Such situation may also be a precursor to skin cancer. The structural change is not only the shape, it will also pop up or dance and become 3D-like. If it is not a single transformation, but a variety of changes in size, shape, and structure, you won't feel any pain when touching it. Therefore, many people will just ignore it, and some people will treat it like having corns. Therefore, people with warts or mole should pay attention to whether these warts have the above changes. Another type of skin changes related cancer is non-Hodgkin's lymphoma. This type of cancer patient first started with itchy skin, rashes. However, when their skin disease show this symptom, they would treat it as a general skin disease. They would take steroid and antipruritic drugs when it's itching. They would never have thought that these were signs of cancer. Therefore, they didn't consult a professional doctor. In fact, some itchy skin or rashes will eventually become non-Hodgkin's lymphoma as shown in the picture. Let's look at the next picture. Mouth and throat problem. Did you see a lot of ulcer inside the mouth? Do you find it quite common? Could be due to being heaty, late night sleep, or having deep fried food. Sometimes we will have mouth ulcer for a few days when we accidentally bite our tongue while eating, and if it recovers after a few days, then that is not sign of oral cancer. But if it is oral cancer, mouth, tongue, throat cancer, then the sign and symptom will be persistent sore throat, difficulty in swallowing, which is difficulty in eating. This could also be a sign of throat cancer, which will affect his appetite. Mouth and tongue ulcer all year round. Oral bleeding is not the same as external bleeding. For external bleeding, we will bandage it as soon as possible. But for oral bleeding, it will flow backward, such as oral bleeding during sleep. Will we wake up to discover it? Usually, we only realize it while brushing our teeth. If some people all year round having foul breath and some very serious, loose teeth will just fall off without any cavities. Loose teeth alone may be periodontal disease, but coupled with other symptoms, it is more like a precursor to oral cancer. Some people have oral discomfort, which will have changes in speech patterns. Coughing and wheezing. Let's look at what are the signs and symptoms of lung cancer. Some people have chronic cough, which may be sign of lung cancer. If coughing out blood, it is quite serious. Wheezing, enlarged lymph node in the neck, but then sometimes you don't feel it when lymph nodes start to swell. Some lung cancer patients even have sign of chest pain. The kind of cough we mentioned here are not the kind of cough that will recover after a few days. Even if it is a whooping cough, also known as pertussis cough, it will stop after some time. This kind of premonitory cough of lung cancer is chronic. You actually see the person coughing all year round. This you have to be mindful because it is very difficult to treat lung cancer. Actual fact, a lot of non-smokers come down with lung cancer. It is due to inhaling of secondhand smoke. Some people will still get lung cancer even they don't smoke, or people around them also don't smoke. Next, let's look at the female reproductive system, the abnormal vaginal bleeding and the possible sign and symptom of ovarian, cervical, uterine cancer. This kind of bleeding is different from menstruation. It is having abnormal vaginal bleeding, pelvic or lower back pain. In fact, our body always gives us a lot of symptoms. So it is important for women to get themselves checked regularly. Why is it? People often have this impression that their days are numbered whenever they are diagnosed with cancer. It is because cancer tumor already grown to 10 cm by the time it was diagnosed, and it's already too late by then. So do consult a doctor early when you discover this sign and symptom. With early detection, even if it is cancer, the success rate from treatment will be relatively higher. Next, let's take a look at if there's changes in bowel or bladder habit, then it could be sign and symptom of kidney, bladder, prostate cancer, blood or pus in urine. So do we bleed when we excrete? No, right? Let's sidetrack a little. You may feel that protein is discharged if you get urine bubbles when you pee. In fact, sometimes pregnant women discharge protein via their urine when they pee. All these are abnormalities and it is best to get it checked. But nowadays, a lot of people rarely notice it. Even if there is blood or pus in the urine, it's because they immediately flush once they are done with their business. Some just walk away without looking at it. Some don't even turn on their toilet light even at night. You have to pay attention if there is burning pain during urination. It is a painful process and often feels really scary whenever they visit the toilet. It could be caused by kidney stone, or it could be kidney cancer, bladder cancer, or even prostate cancer. If it is back pain or pelvic pain, it's also related to this cancer. So do not underestimate it if there is any changes in bowel and bladder habit. In recent years, I often heard from people around me that even having a check few times thought it was just urethral inflammation, having blood in their urine. Some children experience pain when they urine. So doctor gave them antibiotics to resolve it. But after a few years, I heard that what he had was cancer. Next, changes in bowel or bladder habits may also be signs and symptoms of colorectal cancer. Food is consumed into the body via our esophagus, then absorbed by our small intestine, and those that our body doesn't need will be excreted via the large intestine. The large intestine is very long and require a lot of fiber to help excrete smoothly every day. If unwanted food is not excreted in 24 hours, stool will be formed and a lot of toxin will be produced, and it is closely related to colorectal cancer. Singaporeans love red meat, and this in turn makes colorectal cancer so deadly. The risk is 2.2 times higher than the average person. Currently, there are about 1,000 new cases every year. This is due to red meat is harder to digest and it will become stew in the large intestine when there is not enough fiber. So what are the signs of colorectal cancer? Bloody stool, abdominal cramp, frequent constipation or unusual frequent diarrhea, meaning digestion not got problem, and some will have loss of appetite. Will the cell in the intestine become cancerous if the intestinal tract has this smelly and moldy smell over the years? Therefore, cancer does not happen overnight. Those who have been constipated for a long time need to pay more attention. Cancer cells will divide and multiply from 1 becoming 2, 2 becoming 4, and so on and so forth. Next, let's look at what are the signs and symptoms of gastrointestinal cancer. Got indigestion and nausea. Some people may think they have poor digestion and it is normal, but sorry to say, having poor digestion also means that it is difficult for their body to absorb nutrients from the food. When a person comes down with cancer, not only is it related to what they eat, but it is also related to what they don't eat. If a person has poor digestion, do you think this person will have enough nutrition in the long run? Of course, it's definitely not enough. So instead of saying what he ate or saying he never eat meat, then why still come down with cancers? So indigestion, nausea, diarrhea, bloating, loss of appetite, burping. Please don't take it lightly if you have one or more of this sign and symptom at the same time. You may think these symptoms are very common. A lot of people have it, but all these symptoms are unhealthy signs from the perspective of preventive sign. Am I right to say that I believe nobody will say that they are 100% healthy, because sometimes we stay up late, stressed, picky at food, and only eat those we like and not choosing those food that our cells need. What are the other common signs and symptoms of cancer? Such as, first one, chronic fatigue. The chronic fatigue here refers to unusual fatigue. Even when with enough sleep, some even sleep 8 to 10 hours daily and still feel tired. Some are even more exaggerating. They couldn't sleep while lying in bed, but fall asleep while sitting down. Have you seen a healthy person get tired for no reason? So what kind of person get tired easily for no reason? That is, people who are sick. Second one, sudden and excessive weight loss means the weight reduced very suddenly and rapidly. Have you noticed some people reduce from their 70 kilo weight to 50 kilo weight very suddenly? Is it they lost nearly 20 kilo? This is called sudden and excessive weight loss. In fact, unless that person has planned to slim down, otherwise a sudden drop of 5 kilo could depict he has some problem. Why is that so? Because nowadays it is so hard to lose just 1 kilo, let alone 5 kilo. This is closely related to our understanding of cancer. How does cancer take our life away? How does it cause a person to die? It is all related. Why does a person come down with cancer and die soon after? Some even die before the course of treatment is over. This is because cancer cells need nutrients during their growth process. But whose nutrients should it take from? It will take first from the energy stored in our body. Humans need food to get calories, nutrients, but cancer cells will take them first because cancers need to divide and multiply rapidly. Earlier, I mentioned that cancer cells will not stop multiplying because the nutrients it needs are much more than our normal cell. Therefore, it will take away the nutrient. When it grows, it will steal nutrients from infected organ. For example, my bone need nutrients, but it will steal the nutrients from my bone and releases toxin and make the organ malfunction. For example, a person's cancer appeared in his stomach. Originally, the stomach is used for digestion. Food used to be appetizing. Then one day I suddenly felt nauseous and had no appetite and felt like vomiting. Actual fact, the stomach was completely occupied by cancer and it has fully disintegrated, causing the stomach to malfunction. Cancer will also cut off the blood supply to vital organs. Cancer also has the ability to weaken the blood's ability to clot. Blood that is supposed to clot but is unable to, which in turn causes some cancer patients to die from hemorrhage. Speaking of hemorrhage, remind me of oral cancer I mentioned earlier. Some people will bleed every time they have bowel movement. They always say no problem, but healthy people will not have such problem. If it is not hemorrhage, then there must be some problem that caused the bleeding during bowel movement. Therefore, have to go for physical checkup. So why do we see that most cancer patients feel tired easily? Because they are anemia. Cancer will also suppress the function of immune system, thus causing patients to die from bacterial or viral infections. So even if we only rely on unilateral cancer treatments method, which I will talk about it shortly, every method has its side effect or it will have further complications. Next, other common sign and symptom of cancer have swollen lymph node because our lymphatic system is our immune system second line of defense. Skin is our first line of defense. All foreign bacteria and viruses enter our body through the skin or enter from the eyes and respiratory tract. The second path is lymph. So if lymph nodes are swollen, it is more likely to be cancer. Of course, this does not mean that lymphatic swelling is lymphoma, not necessarily. If the above symptoms are accompanied by frequent infection of flu-like symptoms, usually doctors suggest checking for leukemia, which is a blood cancer test, and also sign and symptom of non-Hodgkin's lymphoma and pancreatic cancer. The symptoms are enlarged liver or spleen. When liver is swollen, you can see the swelling on the chest and above the abdomen, and it will be solid feeling when you touch it. So what will we do when we discover or check out that we have this abnormal symptom? Usually we will consult a doctor, and doctors' common cancer screening method include tumor markers. Is to analyze whether there are tumor markers in our blood and urine sample. But this may not be able to tell the stage of the cancer, including tumor size, location, and how much it has spread. In general, tumor markers themselves are insufficient evidence to diagnose cancer and can be elevated by non-cancerous situation. For example, a raised CA125 tumor marker in the blood test may indicate ovarian cancer. It could also result from benign conditions like pelvic inflammatory disease, menstruation, and pregnancy. Many a times, early stages cancer may not show elevated tumor markers. So, tumor markers are usually most effective when used in combination with other diagnostic methods. Surgical biopsies. Sometimes a tissue sample may be needed to diagnose cancer. An invasive procedure called a biopsy is usually performed to take a tissue sample by inserting a thin lighted tube through the nose, mouth, or rectum. Statistics show that biopsies aren't altogether dependable. Only 11% to 25% with suspicious lesion actually have a malignancy. Fluctuations in the ability to discriminate between benign and malignant cell. X-ray is generally the most common. Mammogram is used to detect tumors in breast and chest, radiograph to diagnose early stages of lung cancer. X-ray can also detect cancer of the intestine, stomach, liver, spleen, and kidney. For example, X-ray cannot be seen if a tumor is 1 cm or the location of the tumor is behind the stomach. You can do an ultrasound scan. If you wanted more details, this screening method can provide images of developing fetus, uses sound wave to make pictures of internal organs, and also for detecting cancer in soft tissues, for example, breast, or endoscopic ultrasound, examining the esophagus and intestine. CT scan, also known as computed tomographic scan, uses X-ray technology and a computer to obtain cross-sectional 3D images of body, including bone, organ, glands, and blood vessels. And it shows not only if a tumor is present, but also how deep it is, and to detect or evaluate if cancer has spread to the lungs. MRI, magnetic resonance imaging, more sensitive than CT scan for distinguishing soft tissues. However, the radiation from CT scan or MRI are much higher, which is bad for the body. Few people will start with this examination unless they discover a tumor in their previous examination. Nuclear medicine, PET scan. Unlike other diagnostic methods, it is to determine if the tumor is benign or malignant, reduces the number of fatal lung cancer surgeries by 50%. The biggest benefit of using this method is tumor detector is usually at an early stage and very likely curable. Whenever a person is diagnosed with cancer, he will seek medical treatment. There are 3 common cancer treatments: cancer surgery, which is surgical removal of tumor; radiation therapy; chemotherapy. Some cancer after surgery will require hormone therapy drugs, such as breast cancer. Let's take a look at cancer surgery. Surgical removal of only parts of a tumor or an entire localized tumor. For example, if a woman gets ovarian cancer, the doctor may suggest removal of the ovaries, and if the woman is already old, the doctor will usually recommend for removal of uterus as well to prevent spreading. Have you heard before? If it is breast cancer, some will have it partially removed and some have the entire breast removed. Some breast cancer cells have already spread to the lymph, and doctor will recommend to remove the lymph node as well. So what should a man do if he had cancer in his reproductive system? And every surgery has its treatment risk. It will stimulate the cancer to spread. Basically, the cancer cell could have already spread even after surgery. Complications during surgery also include uncontrolled bleeding and damage to internal organ as a result of tumor removal. It will bring side effects like pneumonia and more prone to infections, internal or external bleeding. Men may suffer from impotency and lose control of bladder or bowel functions. Surgery alone is not enough to treat certain types of cancer. So in order to ensure the elimination of residual malignant cells after surgery, doctors will use electrotherapy, chemotherapy, or other types of treatment. Radiation therapy, also known as electrotherapy, use high-energy radiation generated through X-ray machines or radioactive isotopes to either completely destroy a tumor or damage cancer cells' genetic material, making it impossible for the cells to keep growing and dividing. Radiation therapy is usually administered externally using radioactive beam or special radioactive isotopes. Doctors will direct the treatment precisely at where cancer cells are present, depth and size of the cancer. Imagine the intensity of the ray energy is like cooking food in a microwave oven. Besides from adjusting the time, the intensity of the ray will affect the cooked food. So the ray energy intensity for radiation therapy is crucial. So why do doctors usually recommend electrotherapy? It is because cancer cells may spread after doctor find out that the tumor is malignant after it was removed. Therefore, doctor's purpose is to electrocute the cells that may mutate around the tumor. This, of course, will bring some side effect and treatment risk. For example, affect the glands and bone is like those nasopharyngeal cancer patients suffering. Patient after having surgery, you will see that they take a mouthful of food followed by a mouthful of water whenever they eat. The main reason is the gland that secretes the saliva. Saliva has been destroyed, which makes it difficult to swallow food. Some people may have darker skin after electrotherapy and may even appear to be burned. In addition, there will be hair loss if radiation therapy is applied directly to the head, nausea, difficulty in swallowing, and oral ulcer and fatigue. Chemotherapy uses cytotoxic drugs to kill fast-growing cells like cancer cells. Chemotherapy's systematic nature make it better suited to treat cancer that have spread to other organs or tissue. Some patients have to undergo chemotherapy within 2 to 3 weeks after surgery. It's because they are afraid that it will spread. It might be too late if waited too long. Ladies and gentlemen, can you imagine what will it do to you when this poison enter your body? It will kill cancer cell and our healthy, fast-growing cell at the same time, causing immense damage to our health. Have you seen some cancer patient undergoing radiotherapy and chemotherapy? What sort of side effect does it have? For example, hair loss, fatigue, nausea, vomiting, rashes, depression, throat inflammation, nosebleed, weight loss, anemia, and look pale. While vomiting, hair loss, or nausea? Because chemotherapy drugs target the characteristic of cancer cells to kill it. Earlier, I mentioned that cancer cells are actually cells that divide and multiply rapidly. And the cell of our oral cavity, scalp, and gastrointestinal tract are also cells that divide and multiply just like our head. It will grow back after 2 to 3 days. When undergoing electrotherapy or chemo, the cells of our scalp, stomach, oral cavity will be killed. Medical treatment is constantly improving. Previously, chemotherapy will encounter hair loss, but now some of it doesn't have such effect. Therefore, Dr. Chow Fei Chen referred to cancer treatment as a form of gambling. What does that mean? It means gambling on whether we kill the cancer cell first or killing our healthy cells first. So no matter what kind of cancer, doctors always remind patients that they need to maintain their weight. They have to pay close attention if their weight keeps dropping during the course of treatment. We have talked about various cancer, their precursors, and the treatment methods. Let's understand about SEER Cancer Data Review from 1975 to 2013. The National Cancer Institute is statistic on the 5-year survival rate for various cancer treatment. So what is the 5-year survival rate of cancer treatment? In other words, when the patient has completed all surgical operation, radiotherapy, and chemotherapy, and there is no recurrence within 5 years, this is called the 5-year survival rate of cancer treatment. Let's take a look at which cancer has the lowest survival rate within 5 years. And the first one is pancreatic cancer. It has a relatively high mortality rate among cancers. Only 8% of pancreatic cancer does not recur within 5 years. This means that 92% of people with pancreatic cancer relapse within 5 years. Lung cancer survival rate within 5 years is only 18%. Esophagus cancer at 19%. Stomach cancer at 29%. Brain cancer at 30%. Ovarian cancer at 46%. So what are the cancers that have more than 50% with a 5-year survival rate? Colon cancer at 65%. Cervical cancer at 68%, kidney cancer at 74%, bladder cancer at 78%. Now that medical science is getting more and more advanced, which cancer have more than 80% with a 5-year survival? This includes uterine cancer at 85%, Hodgkin lymphoma at 86%, breast cancer at 89%. Melanoma at 91%, testicular cancer at 95%, and prostate cancer, previously only 76%, 98%. This proves that medical science is advancing, but we still cannot rely entirely on medical treatment because the 5-year survival rate is not called recovery. It does not represent recovery because it does not mean that there will be no recurrence at the 6 or 7 year. Therefore, as the saying goes, you have to fight it for life once gotten cancer. In fact, everyone has cancer cells and we have to fight with it every day. Now we have understood that cancer does not happen overnight. We can discover it early by observing whether there are any abnormal changes or signs and symptoms in our body. We should consult professional doctors for physical examination if there is any abnormality. So when a person is diagnosed with cancer, they usually will look for treatment, and the treatment methods that doctors provide are the one I mentioned earlier, like surgery, radiation therapy, chemotherapy, and so on. At present, we already know that all surgery has risks, and the treatment of this cancer will also bring complications and side effects. And also, the successful treatment rate is not high for some difficult to treat cancer. This cancer treatment may be able to improve the survival rate of cancer patients. But have you ever wondered what kind of price they have to pay? Sometimes treatment can only help to prolong a patient's life for a few months or maybe few years. But does this really improve the patient's quality of life? In fact, doing prevention and early detection and early treatment are still the best way to fight cancer. In fact, preventive healthcare include regular health checkup and proper health education. This in turn can help to avoid cancer and other deadly diseases. More and more evidence showing that nutritional immunology, which is a preventive side, will become a key role in the fight against cancer. Through sufficient sleep, regular exercise, positive mindset, balanced diet, and maintaining a healthy immune system is the most reliable and safest way to fight cancer without any side effect. In fact, why do we need to understand about cancer? Because we want to prevent world number 2 killer, which is cancer, from happening. We can prevent most of the diseases from happening as long as we can prevent cancer. With this, my sharing ends here. I wish all of you good health and longevity. Thank you.
Thank you, Cindy, for her wonderful sharing. Through her sharing, we understand that cancer does not happen overnight. We can discover it early by observing whether there are any abnormal changes or signs and symptoms in our body. We should consult a professional doctor for a physical examinations if there is any abnormality. In fact, doing prevention and early detection and early treatment are still the best way to fight cancer. So, has anyone through nutritional immunology's food product to win back their health? The answer is yes. And tonight, we have a testimony shared from Jacqueline. She was diagnosed with lupus at the early age of 20 and having to undergo kidney dialysis at the age of 28. A sudden giddy spell hit her one day, and that giddy spell resulted her in half-body numbness. Let us listen to her story of how she walks the path of recovery. Let's welcome Jacqueline.
Good evening. Thank you for having me here tonight. My name is Jacqueline. I want to thank my sponsor for introducing nutritional immunology to me. The knowledge and the product definitely serve a very huge positive impact on my life. A little background on myself. I used to be an athlete during my school days. But by the age of 20, I was diagnosed with lupus. During that time, all my career goals, my holiday dreams, and even my marriage was shattered because I started battling the side effects of medications, one of them being steroids, and very frequent hospitalizations. In fact, before my 28th birthday, I was already on dialysis. That was total kidney failure. Sad, right? Thank God I get to know nutritional immunology that eventually turns my life around. Tonight, I want to share an experience that happened last year. It was during the circuit breaker, May 2nd. It was a Saturday morning. Everything was good and fine like normal. But a sudden giddy spell hit me. And that giddy spell started an episode of a stroke. When the second ambulance brought me to Tan Tock Seng Hospital, it was 5 hours later. And what happened to my body is that already half of my body, the left half of my body, has gone totally out of control. It was very, very scary. Very scary that I cannot feel my body, not even my tongue. So during the hospitalization, so much drugs were pumped into my body that it affected my liver. It affected my pre-existing conditions. And my liver suffers toxicity. I know the doctor said the ALT was very high. To cut the story short, I was discharged after 1 month. That means 30th May, I was discharged upon my persistent request. So when I reached home on wheelchair, because I couldn't sit by myself and I couldn't stand yet. But at least I was positive because I have my products at home. And I can start taking back my usual stuff, which is Rhapsody in the morning, my soy green, as my breakfast, and my immunity and berry bit in the afternoon. And throughout the whole day, I can drink my Cha Moment as a thirst quenching drink. And being worried about my liver index that is high, I remember hearing a testimony that shared about the product Raising Tree that nourishes the liver. So immediately I put in the order and start taking one additional product, Raising Tree. I persistently take it every day without fail. And till the day I have to go for my first follow-up after discharge, it was 6 weeks. I remember the date was 13 July. And guess what? I walked into the doctor's consulting room independently. And that shocked the professor that was treating me the whole month when I was in Tan Tock Seng Hospital. She said, "You walk in alone?" I say, "Yes." And in fact, I drove there. Amazing, right? She asked how I recover. Frankly, I really don't know. The body recovers at a very speedy rate. I can stand, I can start taking baby steps, and I can start walking. Started by holding on to somebody else, and eventually I can walk in 6 weeks' time. But what amazing I want to share with you tonight is my results. Upon reviewing my blood results, my liver went back to the normal range. And that was the biggest joy I remember in my doctor's room. And not only that, including all my other blood results, it was just a mere 6 weeks of persistent taking my products. Now you can know why I'm such a strong believer of my nutritional immunology products, right? I remember the professor said, "You are so lucky to have almost full recovery." She used the word almost because at that moment, my left arm from here to my fingers, it was still totally numb. Although I can walk, my leg is recovering, but this hand was still numb. I can lift it up, but it was numb. And she said it will not be well fully. Very sad that doctors give negative news, right? But I want to encourage you. Today, this hand is 90% healed. It may get numb, but that's once a while, not the fully numb that was 1 year ago. So, do you think this is really unlucky? Well, if you think so, the luck, to me, I believe, is the decision that I made years ago when I decided to take care of my immune system after hearing the science of nutritional immunology. So I'm so thankful, I'm so grateful. I'm so thankful to Dr. Chan who founded the science, and I'm so thankful to my creator that helped me throughout the whole healing process. And dear friends, tonight, if you have yet to know nutritional immunology, I urge you, please explore. It is a true science that's going to bring true health. Do not miss it. Do not learn the importance of our immune system only after something happened. It is a very high price to pay. I do live a normal life now. I enjoy my life, just like anybody else. But I still have to go for my dialysis. So please, I hope my sharing can inspire you to really look into start taking care of your life. Thank you for hearing my sharing. Good night.
Thank you, Jacqueline, for your sharing. I'm really happy for Jacqueline regaining health through nutritional immunology products complete nourishment series. Through proper nourishment of our immune system with the right nutrients, our cells will be able to repair and revitalize. Let us congrats Jacqueline again to gain back her health. Please take note that disclaimer here. Ili products are plant-based food which are very beneficial for health maintenance. However, Elite does not advocate any form of self-diagnosis or medical treatment. If you have any medical conditions, please seek professional medical help. So now, next is our Q&A session. After the insightful presentations, I'm sure many of you have questions. Feel free to unmute and ask your question or type it into the chat box. Let me see. Wow, today's chat room is very lively. Yes, I see there's a question in the chat room here about a friend with cancer said that his doctor told him not to consume any health supplements. Elite products suitable for him? Thank you for bringing up these important topics. Do we have someone from the Q&A committee who can help address these questions?
Thank you, MC. I will help with answering this question. So good evening, everyone. I'm Darren, and this is a very good and common question which I had experienced before. So let me repeat the question. A friend with cancer said that his doctor told him not to use any health supplements. Now, first, let's understand different roles of medical professionals. Now, do you know the distinction in skill sets between doctors, pharmacists, nutritionists, and nutritional immunologists? So doctors, they diagnose illnesses, review reports, perform surgeries, and provide treatments to alleviate sufferings. Pharmacists, on the other hand, they are experts in medication and can inform you about side effects. Nutritionists, they focus on basic nutrients necessary for survival, like carbohydrates, protein, vitamins, fats, and minerals. Now, if we want to enhance our immune system to combat diseases, whom should we consult? We should consult or seek advice from experts in nutritional immunology. So Dr. Chow Fei Chen, the founder of nutritional immunology, is an authority in this field. Nutritional immunology primarily explores the relationship between nutrition and the immune system, emphasizing prevention over cure. The three key nutrients for boosting the immune system are phytochemicals, antioxidants, and polysaccharides. So by consuming the right nutrition, people can achieve not just survival, but also health and longevity. So in addition to the above, we must also understand, why doctors advise against supplements. So doctors often advise against health supplements because some contain added medication like steroids and diuretics. And this can interfere with prescribed treatments, potentially causing overdose or rendering treatments ineffective. For example, if both a supplement and a prescribed medication contain steroid, it can lead to excessive steroid intake. Therefore, doctors often advise patients not to use health supplements for safety reasons. So I usually advise friends that, when you are sick, you need to follow the doctor's advice. But ultimately, the decision to undergo treatments or not lies with the patient, right? So to encourage patients to think, I will ask them to consider this scenario. So imagine you tell the doctor, I will strictly follow your advice and I will not use these products, only focusing on treatment advised by you. Now, can you guarantee my recovery? Now, of course, doctors cannot provide guarantees. Otherwise, why would they ask patients to sign indemnity forms before surgery or treatment? So ultimately, our life is our own responsibility, and decisions about health require our wisdom. It's not as simple as saying, the doctor told me not to take, so I don't take. So next, I will let the patient know the difference between medical science and preventive science with regards to cancer prevention and treatment. So example of medical science treatments include surgery, chemotherapy, immunotherapy, and radiotherapy. Now, these treatments target cancer cells, but can also harm healthy cells, leading to side effects like nausea, hair loss, mouth ulcers. And this weakens the immune system and can cause other health issues. So Dr. Chow Fei Chen, a science researcher of more than 30 years, once described such cancer treatment as a gamble. So what does that mean? It's a wager between prioritizing the elimination of cancer cells or preserving healthy cells. Preventive science, such as nutritional immunology, focuses on relationship between nutrition and the immune system. It emphasizes prevention and maintaining a healthy lifestyle to boost the immune system. Now, our immune system produces NK cells natural killer cells, which can detect and destroy all kinds of cancer cells. And a healthy immune system will be able to produce enough NK cells to prevent or destroy existing cancer cells. I will then share with him cancer doesn't develop overnight. It takes time for cancer cells to grow to a detectable size. So factors like poor nutrition, lack of exercise, insufficient sleep, and chronic stress can weaken the immune system, making one susceptible to cancer. So when immune system is already compromised, treatment like chemotherapy can make the body even more vulnerable. Therefore, boosting immune system through nutritional immunology can help combat cancer without causing conflicts with treatment like chemotherapy. Now, at this point, I will further share with him on the 3 main nutrients based on science of nutritional immunology that can help combat cancer, which are phytochemicals, antioxidants, and polysaccharides. Now, let's start with phytochemicals. So different types of phytochemicals have varying ways of preventing cancer. Therefore, the more diverse the variety of phytochemicals, the better the body ability to resist cancer. So for example, the cactus contains over 10,000 different phytochemicals. Some of these phytochemicals can inhibit tumor growth, such as flavonoids. They prevent the formation of new blood vessels in tumors, depriving cancer cells of nutrients and eventually causing them to wither, and suppress tumor progression, preventing it from spreading. And some phytochemicals can even neutralize carcinogenic hormones before cancer cells can even form. Another group of nutrients that can combat cancer is antioxidants. Now, antioxidants are nemesis of free radicals. A significant amount of antioxidant makes it difficult for healthy cells to be invaded by cancer cells. Therefore, antioxidants can prevent free radicals from disrupting normal cells' DNA, delay organ aging. So the organ age is one of the key criteria for faster recovery ability. Now, it also promotes cell repair functions, stimulate the production of collagen, inhibit cancer cells spreading. And do you know that cancer cells spread through blood vessels? But how does collagen prevent cancer spread? So if the outer wall of blood vessels contain collagen, it traps cancer cells and summons other immune cells to destroy them. And there's another indispensable nutrient in the fight against cancer, which is polysaccharides. So polysaccharides can enhance the body's secretion of interferons and interleukins to accelerate the destruction of cancer cells, boost NK cell activities by up to 49 times to combat cancer cells. And polysaccharides have the ability to prevent normal cell mutation from turning into cancer cells. Now, I encourage everyone to explore the science of nutritional immunology, which advocates prevention than cure. Combine it with healthy dietary habits, emphasizing more vegetables and less meat while increasing immune-boosting nutrients. Moderate exercises, maintain a positive mood, and getting sufficient sleep. So even healthy individuals can benefit from this approach to enhance their immune system. For cancer patients, appropriate nutrition can help boost their immune system and support their treatments. Nutritional immunology foods are plant-based and suitable for everyone, including expecting mothers, children, and elderly. So I'm confident that if doctors understand this, they will support their patient in using our products. Thank you for listening to my sharing, and I hope I have answered the question. So over to you, MC. Thank you.
Thank you so much for Darren's answers. I'm sure it will be helpful to our friends who asked the questions. Due to time constraints, we will end the Q&A sessions now. So next, I'm excited to update you some upcoming events on promotions. There's a good news here. Elite have special gift set promotion for Goji Garden coffee in November. If you purchase 5 boxes of Goji Garden coffee and 5 boxes of Goji